I became Christian's guardian when his mother, she overdosed. Immediately after she died, I had to go ahead and get custody because of the fact that basically he needed health care. When she died, he was here when she died, but I wasn't. I don't know what exactly he saw. All of a sudden, he stopped talking, and then he wasn't really eating. He didn't start talking until he was about 4 years old. So I didn't know if he knew his colors, knew his name, or anything. Then all of one day, he just said red. This year in first grade, he fell out. He was remembering about the blood, the needles. I didn't know what to do. His teacher had already told me that there was an available system at the school where they had counseling, and she asked me what I would like him to see it. When his mother needed mental health, I had insurance. My husband had insurance. I also worked for the government, and we had an employee program. Couldn't get a counselor. They finally gave me an appointment, would have been 2 months down the line. It was really hard trying to find somebody to assist us because they're all booked up. I was able to see care right away within about a week. I filled out the form, made an appointment, they spoke with me, and then they brought Christian in half an hour later. Grief comes in a wave, and they explained to him about death. When people go to the hospital, what may happen to them.
So having a mental health professional on site has allowed us to keep kids in class. If kids aren't acting up and they're not having mental health issues, they're in class and they're learning. Having somebody on site to be able to address the kid right there, to be able to treat the kid right there. And that's another issue, is like the parents don't have to go somewhere to get their kid treated. It's all right here in the school. This is the model for every school. And when you see it in action, and when you've lived it as an administrator, I mean, I couldn't imagine going to a school that doesn't have it right now. If you look at the history of schools, they were always the center of the communities. So it only makes sense to bring these services into the center of the community. But before, if you had a kid who had a mental health issue, you would basically say, hey, there's this doctor in Wilmington. So a lot of these parents don't have transportation, they're never gonna get them there. Right now, I can pretty much say, hey, we have somebody right down the hall that can work with you through Nemours. These kids are engaged, they're in class, and they're learning. And that's the overall goal that we want. Look what's going on here, look what these kids can do, and look at the impact that we're making on the families.
I feel very fortunate to have Nemours here at our school. I think people should know that the program is a huge benefit for especially the parents while the students are at school. I think the Wellness Center needs to be spread across the country because students need this no matter where they are. It's super important for every student to have access to physical health and mental health.
Being able to get an assistance, it's been a great, tremendous help. I didn't realize that it comes in waves. And I didn't ever want him to see me upset because I thought it might freak him out, but they're telling me that he should see that emotion because then he would feel okay to show his. It's been a great help to the both of us. To get a therapist or to get someone to talk to a child, to wait 2 months and they're hurting now, it's crazy. With being in school right away, they were able to address those issues. And I think that's very important. But I see a change. He's not crying in class now. He's not upset emotionally anymore. It's important for every child to be able to have that kind of access. And I sure hope the government or state funds those programs for children.